You're listening to the Body Contouring Academy's Proven Profits podcast. Your source for non-invasive body contouring. Here we reveal the blueprint to generate more revenue and realize the profits you want. Stay tuned to hear insightful interviews from industry experts and successful business owners on what strategies they use to grow their body contouring practice. We love non-invasive body contouring. The machines and technologies are effective at improving body conditions, and they're safe when used properly, but nothing is without risk. Hello, fellow body contouring professionals. Kay here. Today, we're focusing on a well-known but very little discussed side effect or complication even of cryolipolysis. It's a relevant topic today because it's recently been brought to the very public eye by supermodel Linda Evangelista because she suffered from it following a couple of cool sculpting treatments. Now, it's true that this complication is most associated with cool sculpting, and that's partly due to the fact that cool sculpting is so well known and that there's so many cool sculpting treatments done. But it's important for body contouring providers to know that it's a risk for any machine that uses the cryolipolysis or fat freezing technology. And even if you don't use cryolipolysis in your business, you need to know about it because your clients have most likely heard Linda Evangelista's story on Instagram or TV, and they may very well be concerned or outright scared. But what are we talking about? It's a complication or a side effect called PAH. It stands for paradoxical adipose hyperplasia, or in English, abnormal fat growth. But before we dive in with a discussion about PAH, let's review the technology of cryolipolysis. It's non-invasive and it utilizes freezing temperatures to destroy fat cells without causing harm to the surrounding tissues. Specifically, what happens is the cold temperature triggers a programmed fat cell death called apoptosis, and then the body flushes out the dead fat cells. Now, this technology has been around and approved and cleared by the FDA for more than 10 years, and it's employed by various fat reduction devices dating back to 2010. And there's so many home devices and so many other machines that use cryolipolysis today that this PAH complication is definitely something we need to pay attention to. So let's discuss PAH. PAH, or paradoxical adipose hyperplasia, is a process whereby fatty tissue grows rather than shrinking. So your client comes in to sculpt or reduce a problem area, and then PAH happens, and now the problem area is worse. It's larger and downright deformed. Now, some machines deliver cryolipolysis through an applicator that's in motion. In other words, you or your team member, as the body sculpting technician, is moving the machine and the applicator over the patient's body. Other machines use static applicators or applicators that are fixed or stationary on the body, and that's the case of cool sculpting. And when this happens with that kind of technology, those kind of applicators, the fatty growth actually mimics a well-demarcated shape of that applicator. And even worse, this abnormal fatty growth has a significant fibrous component, so the PAH areas are not only larger, they feel firmer and just different than the surrounding areas. But what causes PAH? Is there anything we can do to prevent it from happening? Well, the truth is, right now, experts just don't know. There's many theories about the cause of PAH after cryolipolysis, but as of now, the official cause, yet to be determined. So, we're cryolipolysis providers, and we're doing these treatments. How do we know Or when do we know, or how can we know, or do we know that the client's going to develop PAH? Well, PAH is a delayed onset condition. It doesn't happen right after the treatment. What's going to happen is between 2 months and 6 months post-treatment, the client that's going to develop PAH will start noticing changes of enlarging, unevenness, hard knots, and just deformities at that time. Okay, so you have a client, or there is a client who has PAH. It's diagnosed. Then what? Can we reverse it with more cryolipolysis treatments? No. You should not treat the area again with cryolipolysis, and unfortunately, it's not going to go away on its own either. This is going to require a referral to a board-certified plastic surgeon who is familiar with the condition of PAH. And in most cases, that surgeon is going to recommend power-assisted liposuction. But unfortunately, the client's going to need to wait and live with that PAH condition for several months, because we're hoping that the fibrous fat's going to soften over that period of time. And why is that? Not only is fibrous fat hard to treat for us non-invasive body contouring providers, it's also a more difficult condition to treat with surgical or invasive body contouring procedures. So after liposuction is finally done, is the patient back to normal? In a lot of cases, yes, but unfortunately not always. Supermodel Linda Evangelista reportedly had procedures done 2 times. Neither were successful, so it appears she's going to have to live out her life with these deformities. Now, does this make you cringe? Because it sure does me. I mean, it is just awful. But why and how does it happen? Well, the truth is, we aren't sure. Experts agree that it is significantly underreported, so we don't really even know for sure how often it happens. You can see from different reports that there's numbers ranging from just a scintilla, like 0.25%, to a pretty large percentage of 1+. But regardless where the percentage falls, it's really bad if it's your client who's among those percentages. So, if you offer cryolipolysis in your practice, what steps should you take? Well, first of all, make sure you're armed with education about it. And the first thing you do is evaluate your clients for suitability for the cryolipolysis technology. For example, clients with poor skin tone in the treated area are probably not good candidates for cryolipolysis. They're better candidates for radiofrequency. Laser lipolysis technologies would be much better technologies for those patients. Number 2, screen your clients for pre-existing cryolipolysis contraindications. So when you're looking for your contraindications, use your device manufacturer's recommendations and refer to your medical people if you have any. Number 3, train your providers very thoroughly about cryolipolysis, and you yourself stay up to date on current training and the latest in education. And 4, educate your clients about cryolipolysis. Make sure they know the risks in addition to the benefits. Provide it verbally. Have a conversation about it, and then have it in writing and obtain that written informed consent. Make sure PAH is in your informed consent form. And by the way, Linda Evangelista says that she was not warned about the possibility of PAH. So what if you're a provider who does not offer cryolipolysis? Are you breathing a sigh of relief right now? Well, probably so, but you still need to act. So it's important to know that PAH has not been associated with any other fat reduction technology, such as radiofrequency, ultrasound cavitation, vacuum, EMS, laser lipolysis. But even so, your clients may be apprehensive about any body contouring treatment now that PAH after cryolipolysis has come into the spotlight. So you need to have the ability to explain PAH to put your clients at ease. So, PAH after cryolipolysis is an example that even though non-invasive body contouring treatments are low risk, they still come with some risks. And we're so fortunate to be body contouring professionals, and as body contouring professionals, we have a duty to continue to learn and improve in our profession. So we're happy you're listening to this podcast. Keep listening. Keep reading our blog articles and take a course or two that might be helpful for you. Well, that's it. Until next time, beautiful wishes.
If you enjoyed the show, please find us on iTunes and leave us a review. You can follow us on Instagram at bodycontouring.academy, and you can always find us on Facebook too. Please email us at info@bodycontouringacademy.com with any feedback, topic suggestions, or to offer to tell your body contouring success story.
Thanks so much for listening. Have a great rest of your week, and as always, and until next time, beautiful wishes.